What would we not do as family members if we're taking care of someone that had a hip replacement?
A lot of things. I do know shortly after a hip replacement, they try to get them up and moving right away. But they need to get physical therapy in place before that person even comes home. So that physical therapist can tell them exactly what to do. There's certain things, how they bend to get out of the chair. What do they do with their legs? Are they crossing their legs so that the legs shouldn't be crossed? They shouldn't lean forward to get up out of the chair. There's things they should and should not be doing, but a professional really needs to be the one in charge. So before they discharge them home, make sure that that hospital has set up physical therapy and they know exactly what they should and should not be doing. Because
Okay.
you can make a vast difference in anything, hip replacement in anything.
Yeah.
With knowledge is responsibility. Get the knowledge before you leave.
And I find obviously every time someone is sent home from the hospital, they will go through that lesson. It's just the point of paying attention and making sure that mom or dad has it and whoever is bringing them home understands all of
Yes.
that.
And it's a whirlwind. It's a very emotional time. You're bringing your spouse or your family member home. So you're more worried about, did I get his cell phone? Did I get his medications? Now when I get home, are his shoes? You're not even listening to what the discharge planner is saying. So if you have them put it in writing so that when you have a calm minute at home, you can look at it. These are the things I should and should not be doing. Because just the way they sit, the type of chair they sit in, how they get out of the chair, what they're doing with their legs while they're sitting in the chair, all of that makes a difference. All of it.